Let's now examine the ionic basis of the action potential. So as we saw earlier, the resting membrane potential in case of a nerve would be about minus 70 millivolt. So the first phase of the action potential is the phase of initial depolarization. Now, what is the ionic basis of this phase? So upon stimulation, there are many leaky sodium channels. These open and there is a small influx of sodium ions, and that is why the potential slowly rises to minus 55 millivolt. The next phase, which begins at the threshold, that is minus 55 millivolt, is the phase of rapid depolarization. Now, why is there a sudden rapid depolarization at minus 55 millivolt? At this voltage, there are a lot of voltage-gated fast sodium channels which open. Now, excitable cells like the nerve, they are very rich in these channels. So at minus 55 millivolt, there is opening of all these channels and there is massive influx of sodium ions along their concentration gradient. We already know that there are more sodium ions outside rather than inside. So there is influx of sodium ions. So this massive influx all at once is what leads to the steep phase of rapid depolarization. Now these channels are different from the leaky channels which are involved in the initial depolarization. Remember that here these are voltage gated. They will only open at minus 55 millivolt. And then we know that there is the spike potential, which is the depolarization above 0 millivolt. Now that is due to continued influx of sodium ions through the voltage gated sodium channels. Now, we know that the peak of the action potential is plus 35 millivolt. So an important question to consider is, why is it that depolarization stops at plus 35 millivolt? Why is it that there is no further entry of sodium ions? Now, the answer is that at this potential, there is inactivation of the voltage-gated sodium channels. So what do we mean by inactivation? Now let's look at this diagram. This is a representation of the voltage-gated sodium channel, and you can see that this is the resting state where the channel is closed. So there is no entry of sodium ions, whereas here the channel is open. Now what is important to note is the channel has two gates. One faces the extracellular fluid, and that is called the activation gate. And one faces the intracellular fluid, and that is called the inactivation gate. So at rest, how is this channel? So at rest, it is the activation gate which is closed. So you can see that this gate is closed, whereas the inactivation gate is open. So since this gate is closed, sodium ions cannot enter. So this is the resting state of the channel. Now when you have a rapid depolarization at minus 55 millivolt, what happens to the channel? So the gate outside, that is the activation gate, opens. So now both gates are open and the sodium ions can easily enter. But the moment the potential reaches plus 35 millivolt, what happens is that though the outside gate, that is the activation gate, is still open, the gate inside, that is the inactivation gate, closes. So now we call this as an inactivated channel. So sodium ions cannot enter, and that is why at plus 35 millivolt there is no further entry of sodium ions because the channel is inactivated. Now, what is the other event that also happens at plus 35 millivolt? So plus 35 millivolt marks the beginning of repolarization. So at this voltage, there is opening of a new set of channels. These are the voltage-gated potassium channels, and unlike the sodium channels, these are slow to open and close. So there is a resultant efflux of potassium ions because we know that there is more potassium inside the cell. So it now moves to the outside, and that is why the membrane potential decreases. So repolarization continues, and we demarcate a separate phase in repolarization, that is after depolarization. Now this is a part of repolarization because potassium exit continues during this phase. But the importance of this phase is that during this phase, the sodium channels, voltage-gated sodium channels, are slowly coming back to their resting state. That is why we demarcate this phase. So at the end of this phase, the membrane potential has reached resting membrane potential. At this potential, the potassium channels are supposed to close, but because they are slow to close, the potential drops further to about -90 millivolt. So that drop in potential is called hyperpolarization, and this is because the potassium channels are slow to close. So potassium efflux continues during this phase. Finally, the gates close. So we have the last phase of after hyperpolarization where the potassium channels have closed and the sodium-potassium pump restores the concentration of sodium and potassium ions. This is very important because by the end of the action potential, we have more sodium ions inside and more potassium ions outside. So the ionic concentration has to be restored, and this is done by the sodium-potassium pump. So what is the significance of after depolarization? As I said earlier, though it is a part of repolarization, this is the phase during which the voltage-gated sodium channels start returning to their resting state. And why is that important? Because now the tissue becomes capable of responding to a second stimulus. That is why we demarcate this phase. Now that we have understood what an action potential is, what its different phases are, and the ionic basis for these phases, let's examine the properties of the action potential. In this context, there are three important properties that we discuss. The first of these is a law that we call all or none law. Then we discuss refractory period, and finally we shall discuss conductivity. Now, the action potential obeys the all or none law. What do we mean by this? Now, this means that either you have an action potential of maximum amplitude or you do not generate any action potential at all. And this depends on the strength of the stimulus. So, if you apply a sub-threshold stimulus, the tissue will not respond with an action potential. So, that's a zero response. Whereas, if you apply a threshold stimulus, the tissue responds with an action potential of maximum amplitude. After this, even if you keep on increasing the strength of the stimulus, the action potential does not increase in amplitude. It has already generated the maximum response. So the peak of the action potential is always constant and will not change according to the strength of the stimulus. This is what we mean by all or none law. So this is a depiction of the all or none law. You can see that when you apply a sub-threshold stimulus, there is no action potential, zero response. Whereas when you apply a threshold stimulus, you get an action potential of maximum amplitude. And after this, even if you increase the strength of the stimulus, the amplitude of the action potential remains constant. It doesn't increase any further. So to summarize, if you apply a sub-threshold stimulus, there is no action potential. If you apply a threshold stimulus, you get an action potential of maximum amplitude. And if you apply a supra-threshold stimulus, you still get an action potential of the same amplitude.